Awake, warriors awake. Juve morning come. Juve. Abaluba yeah, yeah. Abaluba yeah, yeah. Abaluba yeah, yeah, yeah. Abaluba. Ding dang 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 is Juve. Ding dang 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 is Juve. Spirit rise come to touch the sun. Darkness pass and the morning come. We done pay homage to the ancestors. We done do the ritual for the libation. So we call in the warriors to stand on guard to protect and preserve this tradition. As we fill each heart, every hollow drum with love. Awake, warriors awake. Juve morning come. The rhythm go turn you round. The warriors coming down. Awake, warriors awake. Juve morning come. The rhythm go turn you round. The warriors coming down. Ding dang 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 is Juve. Ding dang 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 is Juve. Iron and steel set ablaze to the dawn. No reason to shelter or run from the storm. The drum call anointing every move we make. The rhythm commanding blood and mind to awake. You can't help but answer this clarion call. Not one man must stumble, not one must fall. Unmasking the spirit, come one, come all. With love. Awake, warriors awake. Juve morning come. The rhythm go turn you round. The warriors coming down. Awake, warriors awake. Juve morning.
Hello and welcome to the Bubb Report. Last week, there was a significant spike in COVID cases in Grenada, prompting hundreds of businesses to involuntarily shut down their operations, owing to the fact that some of their employees were exposed to the virus. The first Grenada COVID wave, which also made its way to the sister island of Carriacou, has also prompted public health authorities to institute earlier curfew hours, shut down inter-island travel, and institute no movement days for the next 2 weeks, primarily on weekends. Overnight, the number of COVID patients warded at the General Hospital went from 7 to 17. The current COVID case count is 1,004 cases, with an infection rate of 387 infections per 100,000 people, according to the Reuters COVID tracker. Also on the report, we discussed the reopening of schools, given the current epidemiological crisis in the country. Schools are scheduled to resume by way of virtual learning only in the first instance, but will revert to in-person learning in the middle of the month. We welcome our guests, Grenada's Education Minister, the Honorable Emmeline Pear, and epidemiologist Gerard St. We thank you for joining us. A pleasant good morning, good evening, good night, and whatever time you're choosing to watch and listen to the Bubb Report, we thank you for joining us for yet another installment of the program, our first installment for the month of September. It is crazy how the year is running away from us. And of course, given the challenging times that Grenada and other Caribbean countries are facing, I know that there are many Grenadian American organizations and charities who are mobilizing to support the people of Grenada at this very difficult economic time. For our part here on the Bubb Report, I've made a decision to donate face masks and other PPE supplies to the country. I know that the minister, the chief medical officer, and the Ministry of Health made an appeal for surgical masks and other surgical equipment that they would need. As I am located in the Washington, D.C. area, I am urging those of you who are also in Prince George's County, Northern Virginia, the Arlington area, if you're in Baltimore, if you are in this general area, please reach out to me via our Facebook page to see how we can mobilize support to help our beloved Grenada at this time. And I want to take this opportunity to welcome the Minister of Education. Madam Minister, welcome to the Bubb Report.
Thank you, Kalon. Thank you for having me. And of course, I want to say special good morning to all of your viewers and your listeners who are
Yes,
on.
yes, I know I know we were trying to get you for a while, but some other folks deputized for you, and I know that you have a busy schedule. So we thank you for taking the time to join us today, Minister. Let's get into it. Of course, we're having a discussion on the ongoing COVID spike in the country at this time, and so I want to get a sense from you with respect to the reopening of schools, what that looks like. How prepared are the institutions for really going back to virtual learning, something that they were not expecting to do or anticipating was going to happen. But here we are.
So I want to start, Kalon, by saying one of the things you want to ensure that you achieve in a crisis is preparation for the next one. You want to make
Mhm.
sure that you build resilience. You want to make sure that the next crisis catch you in a better position. And when a crisis is prolonged as this one, at every stage, you want to be able to improve. You want to be able to be in a better position than you were at the previous stage. And I think your question nicely captures that, in that what we are about to do now, it is not our first time,
Right.
right? We've been through this phase before where we had no one in the classroom and all of the students were at home, the teachers were at home, and we were delivering lessons online. Now, how have we grown in this process? Now, when that started, the issue was no devices, connectivity issues. The issue was, wow, we never did this before. Some people say, all I know is how to turn my phone on and turn it off. I don't know how to find Zoom. I don't know how to, right? But where are we
Right.
now? And there was a lot of frustration. I don't know if I can cope with this. I just don't know. I've seen people literally throw their hands in the air saying, I don't know I can do this. As a matter of fact, I engaged with a teacher friend of mine who came to my home, Kellogg, to say, listen, I've made up my mind. I'm done with teaching. There's no way that I can do this online thing. This is a
Hmm.
guy who is probably about 2 years older than me, but like me, he's a bit old fashioned. So he
Right.
cannot see himself transitioning from the chalk and talk to online. And
Hmm.
thankfully, about 2 days after that, there was a training for District 3. As a matter of fact, all the districts, but he's in District 3. And I remember the afternoon of the training. He called me and he said, I'm not going to call names, but he said the facilitator was excellent. I've changed my mind. I could do this. All I need is a laptop.
Hmm.
And
Right.
I'm making that introductory point to say that we are not where we were when we started. So we have distributed devices to all of our teachers, laptops to our teachers. Most of our students would have devices, and we have also programs that can facilitate that. As a matter of fact, government has also been assisting families with connection of internet at their homes. And so where we are, we have to give thanks to God, first of all, for where He has brought us, and to know that where we are now, to use this opportunity to even prepare better for what is to come in the future, whatever that is. So we actually have adopted within the education sector 3 modes of operation. So we no longer start from scratch. All we say is stakeholders, we are moving to mode 1, mode 2, mode 3. And those modes interchangeably, they take you to what the circumstances require. So does it require full lockdown of our school? Does it require partial lockdown, meaning some students come in and some stay at home? And so I believe we are far better prepared than we were. And what you're going to be seeing from Monday is online teaching and learning. And we are going to be continuing our training program as we have been doing in the past. We are going to continue to provide support. We are going to continue to be there for all of our stakeholders.
Minister, with respect to just the reality of COVID infections, with respect to the reality of how education officials, teachers, administrators, even kids are impacted by COVID infections, do you have a sense of what that looks like in terms of who would be able to have the capacity to attend classes, or administrators who would be actually present for teaching on Monday?
Mhm. Yes, so COVID, of course, Kelon, affects all of us in different ways. One of my sons started stuttering during the pandemic. And so for all of us, we are affected in different ways. Some ways we might not even be aware of. Within the education system, what we have provided, particularly during the last lockdown, counselors on call. So every school having access to phone numbers of people they can call throughout the day after the regular hours as well, providing that kind of support. Of course, as leaders in the system, so whether you're a principal, whether you are an administrator, of course, part of leadership includes being able to provide that kind of not just leadership, but support to followers. And so within the system, we have been coping. We have been coping. I've seen people grow during this period, both in terms of their leadership and ability to provide that kind of leadership and support. But of course, there's always room for improvement, there's always room for growth. And so we also tap into the national pool of support as it relates to, for example, counseling services. So when hours may be limited in any way, we tap into the national services that are available. So we continue to provide that support. As a matter of fact, we've gone so far as to say, in the case of a principal, for example, I mean, if there's a challenge with leading in this difficult time, you find it totally impossible to cope, let us know. We would provide relief, we would provide support. And so the same applies for everybody across the board. We are sensitive that this would affect people in different ways.
hmm Now, Minister, with respect to the decision to go back in person, is that decision set in stone? The date, I believe the date is the 20th. Is that set in stone,
Right.
or would you
And
be?
it's always dependent on the situation. So you give
Okay.
yourself a period. So in this case, most of what applies now is for a duration of 2 weeks. And that is why the 2 weeks period was actually announced. But of course,
hmm
the situation is very fluid and it changes quite rapidly. And so, if you ask my personal opinion as to whether or not in 2 weeks we'll be back face to face, my personal opinion might be not likely, right? But we still serve a God of miracles, and let us still be very optimistic and see what happens at the end of 2 weeks.
Now, Minister, digital access, as you said, and innovation is important. What are we doing for people and for students who may not have the laptops, may not have the technology and the tablets to be able to facilitate their learning?
Right. So when we started this pandemic, at the start of this pandemic, one of the challenges we had is that there was no government program where devices were provided to students and teachers, right? And that was the same for most countries in the region. And we have moved, as a matter of fact, we've been commended at the regional level for government's move and swift move in that regard. We were able to secure and to procure over about 26,000 devices. That's for students within the system. And so we've made the round several times at the secondary level. So all of those persons from Form 2 to Form 5 would have devices if they've collected them at the school. And I'm saying Form 2 because remember, Form 1 is just going in. So these students are to now collect their devices, those new students entering secondary. At the primary level, we've also been able to make a few rounds of distribution. That's before this phase of the pandemic. And we started distribution grade 1 upwards, right? So these students, once they've collected from their schools, they should have those. Because of the current situation, we were unable to facilitate anyone who was not able to pick up before. And so what we've said is that there is a special number that person can call, which is the number they used to call in as the hotline, e-learning hotline at the ministry, and they can make arrangement for individual pickup. We've completed the rounds of distribution to teachers. So all teachers in our system now, from preschool to secondary school, should also have the devices. So we've made a lot of progress, significant progress. And what we do is we continue to work. As I said, every stage of the crisis, you should be growing and you should be building resilience for whatever is ahead, whether it's in the near future or down the road.
Now, Minister, with respect to testing protocols for when school reopens, what protocols are in place for students and teachers becoming confirmed COVID positive cases after attending school? Is there a protocol for, or is that built into the current system with respect to the overarching testing protocol in the country?
And as the situation changes, of course, decisions are going to be taken to suit the situation. So it's our very first time that we are at those numbers. It's our very first time we've had the number of deaths we now have. And so it means that, of course, those decisions that we've taken before would have to be reviewed. So, for example, we never had testing in school. I anticipate that once we are reopening, there are going to be changes to the protocols as it relates to testing, as it relates to monitoring, because of course, our situation is very different now. What we are advising persons is that during the 2 weeks that we are not in the classroom, you want to take advantage of those pop-up testing facilities and to get tested. We're encouraging our students, of course, their parents would have to take them. And we're also encouraging our teachers to do same. Now, very importantly, is not just the issue of testing. We are also encouraging the vaccination of teachers and students during this period. Kellen, I cannot overemphasize.
Minister, just pause. Okay, go ahead. We can see you now. Go ahead. Sorry, I didn't mean to cut you there.
Yes, I was making the point that we are encouraging our constituents, and in this case, we're talking our stakeholders, our teachers, our students, our administrators, all of the persons within the education sector. Please, if you feel that you have been exposed to someone with the virus, we are encouraging you to get tested, right? We want to encourage you to get vaccinated. And this 2 weeks window is providing an excellent opportunity for preparation for the next phase. And that next phase, we would love that next phase to be everyone can return. And it would be obviously a plus if many of our students and teachers are vaccinated before returning back to classroom. Of course, we continue to monitor. We cannot say at this stage what will happen next. We cannot say, because all of that would be dependent on the national situation as it relates to the statistics.
Now, Minister, a couple trade union folks, leadership in Grenada, I suppose some clarity needs to be given on the question of directives for teachers in the next few weeks. Now, that the police listed specific places that should be opened. Are teachers expected to report physically to school? What does that look like? What is the specific directive? And could you give us some clarity on that?
So when it comes to directive for teachers and principals, we don't normally communicate that in the public domain. We send what is called a circular to the schools. When it comes to students, we would normally do a press release. But for teachers and principals, we don't normally do a press release. But I can tell you what the last two communications were. Prior to the spike, and I mean it being as it is right now, and prior to cabinet meeting in the last week outside of its regular Monday meeting. So at the Monday meeting last, the decision that was taken, and remember, Ministry of Education don't operate in isolation. We take directives on in this pandemic. So prior to that, the decision was as it relates to planning week, right? So what we had announced then at the time was to do with planning week. Planning week is that week before that teachers go in, they do their schemes, they do all of their preparation, they have new students coming in, so they start putting things together so they know what's going to happen for the term. It is where principals meet with teachers and give them guidance, welcome them back, and start the preparation. So for planning week, the decision of the government was that teachers are going to report to school for that 1 week period. Most schools traditionally complete that week in 2 days, sometimes 3 days.
Right.
And so
Yeah.
we said, if you've completed and you've achieved your goal within 2 days, within 3 days, whatever, of course, you don't need to report back. That was the directive given to principals. You come in, you get done, you take, as a matter of fact, we advise if there are documents you need to take in case, you do that. Now, after planning week, it is when we made decisions as it relates to what happens next, meaning for tomorrow. And so a circular was sent to schools, and that circular now said, beginning Monday, teachers, as was previously announced, are to provide teaching services to students online. If you have the resources at home, because remember, previously, some teachers said they were not able to teach students during the lockdown. They did not have the facility. They did not have internet. Some person said, I do have internet. It's my right. I'm not using it to teach students, right? So the circular is now saying, if you have the resources at home, you have the facility at home, you are comfortable providing the service from home, and your principal is comfortable that you've made such preparation, your principal will now authorize that you can stay at home and deliver the service. In other words, it's not just staying at home. We must do things professionally. We must do things right. So here I've prepared, I have my scheme, I have everything, I'm ready. And I also have stable internet at home, and I'm prepared to use my internet at home to provide the service. Now, in the case where a teacher is not prepared to provide the service from home, whatever their reasons might be, the government of Grenada is saying you can report to your classroom, and you by yourself in your classroom can provide that service from there. Guided, of course, by the principal of the school. So it's all locally based. The principals assess, the principals give guidance in this situation.
So, right. So, and of course, the principal would know what's happening on the ground. Minister, one final item on education, then we would segue into some constituency matters, some information matters. You are the Minister of Information. And as a journalist, I have some questions about media policy, but I will get to that quickly. But Minister, with respect to the 4%, that has been a contentious issue, and one may say that the relationship between union and government has been severely bruised over the last 3 years. That student learning outcomes have also been impacted, which a point that you made. Now, how do we get to a place where we can have a better relationship between state and union, and what do you plan to do to perhaps extend an olive branch to those folks?
So I normally say this, Kellon, as it relates to the Ministry of Education. So let's start at the micro level first. And as it relates to the Ministry of Education, I believe we have a very good working relationship with the unions. Grenada Union of Teachers. Unfortunately, when it comes to money matters, it appears that there is not as much of a willingness to collaborate and to cooperate and to discuss and to reason and, and to come to solutions on money matters. So minus money matters, in a general sense, I think we have an excellent working relationship. There's a facility where once per month the union is affording an audience with the Ministry of Education, primarily through the Chief Education Officer, where they can come in, raise any concern, ask any questions. And of course, outside of that formal meeting, we have also opened that window where WhatsApp, a phone call, and so I get the WhatsApp sometimes, I get the phone call sometimes. We do have that kind of relationship. Of course, unfortunately, that 4% issue, and there was a previous one, Money Matters, we have not been able to see that level of collaboration, partnership, understanding. And it's a little bit unfortunate, I have to say, Kellon, particularly, let me just speak to the issue of the 4%. Government consistently, and up till today, I still don't understand the match between that and the actions that were taken. I have to confess, I still don't get the match. The government said to the unions, look, we agreed, we owe you 4%. We are prepared to give you 4%. We have given you consistently over the years the 4% increase. So if you track back, you would see that each time we commit to an increase, we gave you. And I always like to add, we even gave you when we did not, as a government, negotiate the increase. So when a previous government negotiated and did not do it, we came and we did it. So consistently every year we did. But that one year, because of COVID-19, our revenues have dropped, in some cases below 50%. And if we're to continue to pay you your regular salary, pay you your other allowances, pay you your benefits, and give the 4%, it would become impossible. That was the government speaking. And so government said, look, could you give us some more time? We think by December, this situation is going to improve. We anticipate that if SG reopens, if this reopens, if that happens, if the revenue on the port continues to go upwards, we believe that by December we will be able to do that. I thought that was a really reasonable request, Kalon, of the unions. Let us continue working through this crisis, knowing that we are committed. Before the end of the year, latest December, we are going to
We seem to have lost the minister
the
there. Let me see
situation, and we ended up where we did, unfortunately.
what's happening,
And
folks. Go ahead, please. Yes.
I do hope that history does not repeat itself in this regard, because I think the only persons who really suffered during this period are our children. Some people think it's the prime minister, some people think it's the government. It's not. The people who really suffered during this period, unfortunately, are our children. We continue to work. The government has always attempted to put out an olive branch, Kenon, and we have no intention of doing otherwise in all circumstances. The government's willingness to meet, to discuss, to go back to the table, back and forth, there has always been that openness, that willingness of the government to sit, to discuss, and to come to agreements. And so I don't anticipate that this would change at all. We look forward to a continued working relationship with our unions and understanding that circumstances, situations changes. And so we sometimes need to give a little to be able to understand and to come through those circumstances with a win-win situation, everyone not being able to get everything that they want.
Minister, two final questions. One has to do with your constituency, and that is the unbearable stench of the sargassum seaweed. In Marquis, in Grenville, I was in Grenada recently. You drive through Grenville, and the stench hits you like a bomb. What is, and we know that sargassum seaweed issue is with us. It will be with us. What is sort of a sustainable long-term plan to really ameliorate these negative this negative stench really and circumstances on the people who live in these communities.
No, and my heart goes out to those persons, Pelon, just like you. It's really unbearable what people do have to go through in those situations. And I also like the term that you use, sustainable, because if you ask me, as a government, we've tried everything possible. We've tried so many different things, including engaging and hiring the persons who are actually employed since the start of this to every day go on the bay, for example, in Soubise, in Grenville, and to rake out, to pull out. But of course, you see the vengeance with which the seaweed comes in. And so it is not always as manageable. So there are days when it's excellent and they can go, they can use their wheelbarrows, they can use their spades, and they can take out. And there are times when they say, Minister, we can't even go in the water, right? Unfortunately, that is the situation. So we've used that method. We've also spent thousands and thousands and thousands of dollars to use heavy equipment, trucks, to pull out when there's a buildup of the seaweed there. But then you have another problem, the damage that is doing to the seafront. And even some of these very people say, no, please, 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 don't bring the machine, don't bring the machine, because after you use the machine, then you have another problem, right? So we've tried all of those measures. And what is happening now is that we have gotten some commitment through Ministry of Environment and Agriculture working together. And so what we are looking is at the on-sea equipment that is going to actually take that away. And of course, I'm hoping when we speak sustainability, we also speaking of what can we do with it to positively impact the society, the environment, what have you. But that is the plan that is on now, the sourcing of these equipment, the procurement of these equipment. And I'm trusting that before end of year, I'm hopeful that we should have that on island. I know the ministries are working aggressively on that through not just a Grenada initiative. I believe it is an OECS initiative, and we are trusting that this would be a better, a more sustainable solution to the problem that we face. But my heart goes out to those persons who are directly affected by this situation.
Yes, and Minister, let us we wind it down because we have to get to the epidemiologist here. Both of you are from St. Andrews, incidentally, St.
Yeah.
Andrews people. But Minister, my question, the final question here has to do, and then we'll get to some viewer comments as well, has to do with the media policy. Now, within recent weeks, the Grenadian media has come down for heavy criticism from especially folks who are friendly to your administration for irresponsible reporting around the carnival season, quote unquote, carnival season, for quote unquote irresponsible reporting around COVID reporting. Now, in the absence of a media policy in Grenada, which I believe has been brought to the government, in the absence of a media policy in Grenada, everything seems to be running roughshod. So I just want to get your thoughts on what you think a media policy should look like, and when can we have such a legislation be brought before the parliament to also include the Freedom of Information Act. Grenada does not have a Freedom of Information Act. And I would like to know, for example, if I'm going to be doing some research on a particular issue, that I can file a Freedom of Information Act request, and that information would be available from the government. So, Minister, I would like to hear your thoughts on that.
Well, let me say, first of all, Kellon, you know that our administration made several efforts as it relates to going to Parliament, as it relates to certain legislation to manage the situation in a way that all of our people can be satisfied, can be comfortable, can be supportive of an environment that is conducive to people's development in that regard. And I'm broadening this to people's development, protection of our people. You are not sure now if you're going to have obscenities being used. I mean, we have come far from where we started. Imagine you can be driving along, you can be sitting in your living room, you turn on the radio station, and there's a song with obscenities being broadcasted, right? So it's broad, and we have to be very concerned. So I believe where we ended up during these carnival activities is not where we started. As I said, where we ended up. Because over a period of time, we have been seeing the degradation, the values, the morals, what we accept as comfortable. Somebody referred earlier to the people who are actually the disc jockeys, people on the radio station. What kind of training do they have? What kind of orientation do they? Are their values in sync with the values of society, right? What is acceptable, what is not? And so when you said a while ago that people were sympathetic to our party, did cry out, right? I think it's across the society. I've listened to people who are in no way supportive of our party, asking what is happening. Somebody who is totally affiliated to another political organization came to my office and offered, Minister, I would like to help. I cannot understand how can we, in the middle of a pandemic, have a television station literally encouraging people from the broadcast to play jab, right? And so I'm making this point to say that the concern, I believe, came from across the board.
Mm-hmm.
People who are not very honest, people who want to hide, people who want to probably disguise, may not say anything, may just
Right.
pretend that nothing is happening. But
Uh-huh.
listen, we have to accept that we have fallen as a society in that regard. And what you started is a conversation that must be continued. If you remember the resistance that our government got to some of the same references that you made, but the time has come where we have to take the bull by the horn and we have to do what is right. There are times when you have to do what is right and not necessarily what is popular, what is right. We have children we have to protect. We have a nation to protect. And so, Kalon, you probably would have jumped the gun because we will be calling on people like yourself. We will be calling on people like yourself to ensure that you are part of a process that secures our future when it comes to the media, when it comes to information, when it comes, I mean, look at what is happening. Almost anyone, and you think back and think of how far we have come in that week, almost anyone could just go on a radio station now and just say anything.
Yeah, and
News,
standards
news has
standards
become
yeah,
anything.
standards have
Anybody
fought.
tell
Yeah,
you, somebody calls you, they just tell you, Kellon just killed somebody in Grenville, and you might be surprised. There are
yeah,
stations that might be carrying this
right,
as news. We
right.
heard Kellon say that somebody, we have to set the standards, and I want to give you that commitment that we are going to be engaging the Media Association, we are going to be engaging responsible persons who want to see better, to be part of this process as we move forward.
And again, for me, it's about I don't want to be accused of always criticizing the media and not doing anything. And that's one of the reasons why I decided to also start the Bubb Report. Because there is a tendency that when folks in the diaspora talk, that we run in remote and we ain't doing anything to change the narrative. So, Minister, is there anything else you wish to add? Actually, let's get to some comments. Here. Let's see. Cheyenne is saying, I was so grateful to GBN for bringing the news live in my room. I don't understand what this is all about. But I think it has to do with just some censoring standards there. Anthony Bridgman, I think in response to Brian, he's saying, I think the union leadership didn't make the right decision in asking its membership to stay home. Stay home. Unions usually have funds to support its members when they make decisions like these. Um, let's see here. Let's get to some other. Jose said I was blocked on Facebook, but Odette Campbell for speaking out about the issues facing Carrick and Petit Martinique. So the media is not friendly to critics. Let's see some other comments. Anthony is saying again, I agree that government has a right to honor previous collective bargaining agreements. However, governments have a right to renegotiate the time of payment based on the current economic situation. Let's see here. Let's get some other comments. Minister, those are general comments that are coming in. Kimberly saying, but again, the government purchased Grenada. Where did you get the money to do that? And if you had this pocket of money, why weren't the teachers prioritized? Brian Grimes, the 2018 December docking of salary by government is a lifetime wound. It has reverberating effects on other matters. Government can change this. And I think, of course, the docking of salaries, Minister Pear, was also an issue. I think it's still a matter in the court that is being litigated. So, Minister, I would give you an opportunity to end with some closing comments. Just unmute your mic, please. Yes.
So thank you, Kellen. I want to first thank you for this opportunity to give an update as to where we are. I want to also use this opportunity to specially express appreciation to the entire education community that has been so very supportive during this period. There has been challenges, there have been challenges, and of course there have been difficulties, but I think through it all, we have all been able to get through this, and we have all been able to make our contributions in different ways. There are things that would have happened during this period. If you ask me, Kellen, I wish they did not. So I wish children did not have to go for such long period without having the opportunity to report to classes, to attend classes, all of those things. But I believe that's in the past now. We cannot change anything about what happened last term and last year. I think what we can do at this point is to accept that we are in a crisis. I think some people still have not accepted that we are in a crisis. So we accept we're in a crisis. We accept we are in difficult times, economically, socially, otherwise. And what we can do is to grab this opportunity and to look ahead, to look forward. How can we maximize this opportunity that we have? How can we use even what is considered to be a bad situation to get good out of it? So how can we improve our online learning system? How can we improve on our education system during this period? Do we put everything on hold and we focus only on COVID-19? Or do we ensure that we have more than one wheel rolling at the same time, doing as much as we can do during this crisis so that at the end of the crisis, we can come out better, we can come out stronger, we can be far more resilient. So I call on all of our stakeholders, let us continue to work together. Let us find the ability to put our differences aside, to see the bigger picture, to see what is most important, for Grenada, Carriacou, and Petite Martinique. And how can we pool our resources? How can we unite our efforts so that, as I said before, at the end of COVID-19, we can all look back knowing that we've done the best that we could during this for Grenada's sake, for our future, and for the children of Grenada, Carriacou, and Petite Martinique. Again, thanks, Kellen, and I continue to depend on the support of everyone to make this possible. You mentioned something a while ago of persons who make reference to the criticism, but not doing anything. And so I want to just say to you, there's so much that we all can do. Like you just said, you started the Bubb Report. There's something that we all can do to come out of this crisis stronger. The question is, what do we do? And what impact is what we're doing having on us coming out stronger? We have an opportunity, it's in our hands. What do we do with that opportunity?
Minister Pear, thank you so much for appearing on the report and for giving us an update with respect to the reopening of schools. Of course, this is a very difficult time for the entire international community. Certainly, Grenada is feeling it even more acutely, especially at this time. So we thank you for taking this time. I know this is a busy period for you, so we thank you for appearing on the report again.
No problem. All the best to you.
Absolutely. That was Minister Emmeline Pear, who is the Grenada's Minister of Education. We will take a break and we would come back and be joined by our resident epidemiologist, my good friend, Mr. Gerard St, just so that we can get a sense of what the COVID picture is looking like in Grenada. Last week was a very eventful week and we want to get into it. Folks, stand by. We'll be right back. And welcome back, folks. I'm happy to be joined by Mr. Gerard St. Gerard, if you can, there you are. I was going to ask you to turn your camera on, but you are back by popular demand. I think, given your last appearance on the Bubb Report, we received some very positive and warm feedback. And one of the requests that some of our viewers and listeners made was that you can appear again, especially during this very critical period for COVID-19 in Grenada. And first of all, before we begin, how are you doing? How is your family doing? How are you managing during this time?
Good morning. First of all, Kalon, good morning to you and your viewers and listeners of the Bubb Report. I'm happy to be again on your program. I'm doing pretty well. My kids, my family is doing well as well. So we're thankful. Just received my COVID test results and it's negative, so it couldn't be better.
Well, that's good. I mean, you work at this St. George's University, so I suspect you have to be tested there as well.
Yes, we've started. Yeah. We've started it, so I've completed already 2 weeks of teaching. There are some students in class, and most of the students are online, and that's in the Master of Public Health program. And there has been over the last week a call for all on campus to get tested. So the last report I saw, over 3,000 individuals were tested on campus, and 15 positive cases were found. That's as of Thursday, I think I saw that email coming in. So the rates are pretty low according to the report on campus.
Okay, Gerard, thanks for that. Now, with respect to the current epidemiological picture in Grenada, we see the positivity rate is extremely high. The hospitalization rate, I think it's the highest we've seen it. We now have 17 people at the hospital. Last week we had 4 deaths, which brings the cumulative death total to 5. Now, the first question I have has to do with vaccination. We've also seen an uptick in vaccinations last week. Now, if you are not tested for COVID-19, right? Should you be getting vaccinated? Because I see there is a rush to get vaccinated, but I do not know if people are actually tested before they get vaccinated. So can you break that down for us, please?
Kalon, it's a thin line here. People are responding now to the fact that there have been widespread cases that we found throughout the island, except I think the lowest percentage is in St. Patrick's. So people are sort of responding to that, and I think seeing feeling the impact a little bit more now that we've had within a week and a half 4 COVID deaths, 4 related deaths to COVID. And as I did say, I think in our first conversation that we had, that until Grenadians start seeing the direct impact among our population, then they're going to start responding. As I am of the opinion that vaccination is a personal decision that one reserve the right to, but also based on the science, would argue that getting vaccinated helps to reduce the severity of the impact that the disease would have on you. It reduces your transmissibility as well. And so that's one focal point that we can use to control the rate at which the COVID-19 variant spreads within our population. There isn't any specific guidance that we have relating to whether or not you should be tested before you get vaccinated. The drive, you see, vaccination produces some levels of immunity, not total immunity, but in terms of your response and the ability of your immune system to deal with the severity that exposure to that pathogen causes is what we are depending on. And so if we can reduce the number of individuals who would need intensive care as a result of extensive or severe symptoms experienced, then that would reduce the burden and also reduce the mortality among cases.
Now, one of the things that we've been hearing in the Caribbean this week has to do with concerns over these mutating variants. Yesterday, we heard about the Mu variant, and an epidemiologist in Trinidad and Tobago raised concerns about a variant that emerged in Colombia. I can't remember the name of it. And Dr. Martin also said that Francis Martin, that is, that he worries about the development of a specific variant that would be endemic to the Caribbean region. Yes, how can we get ahead of this? This is all very depressing news.
It's a relatively challenging period for public health and medicine. Just let me back up a bit. There are two main variants that we are concerned with outside of the Delta variant that we're experiencing now. There's one that has been identified in South Africa in May. It's the C12 variant that is showing the potential to have mutations anywhere between 44 to 54 different strains, which is sort of scary. But enough research has not been done on it. This variant has been identified within South Africa in May. It has spread to some countries in Europe already, but it's a very small percentage of cases that we are seeing so far. So relating to the transmissibility and the severity of illness, we do not have evidence to say that it's going to be as dangerous as the Delta variant. However, it has the potential. And there's a second variant that was identified in Canada as well early on this year. Is the C1162 variant. Already is they've been identifying it as causing illness, and a very small percentage of cases again within the Canada's population. Now, Kellon, the interesting thing about this is that this virus has shown, based on our knowledge of it, the potential to cause many mutations and resulted in lots of variants. So what Dr. Martin is saying could be quite true, in that eventually there's going to be one of the variants that's going to become endemic to the populations in the Caribbean. Maybe one, maybe two. Largely, it depends on how much it affects us, depends on our immune responses. And again, we say exposure to the pathogen causes a natural response. Exposure through vaccines causes a natural immune response as well. One of the things, though, that we are concerned about, as I've read, just trying to educate myself on the virus, is that there's some concern as well that the variants may eventually develop immune elusiveness, in that one vaccine would not be able to provide immunity levels that we are quite comfortable with. Again, we have no evidence of that, but there is this potential there that they're seeing for that virus to develop such a variant.
Mm-hmm. Oliver Benoit is asking, and listeners and viewers, please, we have our epidemiologist here. Pose your questions as generously as possible. Oliver Benoit is saying, what is the relationship between the individual decision and the societal needs vis-a-vis vaccine? Which predominates? And I think that is a debate that we will constantly have.
That's a debate that we can go on and on with, but we all have an individual responsibility, Kellon, first and foremost. An individual responsibility to control the spread, to prevent the spread to susceptible individuals. What can we do is a question. We can adhere to the protocols that has been established, that has proven to prevent the spread. So a simple habit as wearing your mask once you're leaving home and wearing your mask properly. Now, some individuals, and I can illustrate, some individuals wear the mask like this, and that is not the correct way of wearing a mask. Another set of individuals wear the mask like this. This is not the correct way of wearing a mask. And some individuals, a few of us, wear our mask like this. This is the correct way to wear our mask. When we wear the mask like this, what are we doing? We are preventing, if we are infected and infectious, we are preventing droplets, contaminated droplets from leaving our mouths, traveling through the air and infecting others. We are also preventing inhalation of infected droplets from others. So, Kellon, by simply wearing your mask properly, it really shuts down and prevents the spread of the virus. Secondly, sanitizing our hands regularly would kill the virus if we do touch contaminated surfaces. At homes, we can continue to sanitize. At workplaces, we continue to sanitize the surfaces like doorknobs, door handles, etc., that individuals will touch regularly. We try to limit the times that we touch our faces, because it's been proven that we touch our faces more times than we even think during the day, and it's a subconscious reaction. So these are the things, and I believe individual responsibility takes precedence first and foremost. Then it comes to whether or not you can, you will decide to be vaccinated, and that again is an individual decision. I encourage individuals to educate yourselves, get your question answered, evaluate the risks that are that exist with taking the vaccine, and then you make a personal decision. So that is a very good question, and we can debate on it over and over. But I'm saying here that first and foremost, we have an individual responsibility to prevent and control the spread by simply wearing our mask, adhering to the protocols, the closed environments, crowded environments, close contact as much as we can, and ensuring that the virus does not continue to spread as quickly as it is in our population.
But Gerard, I want to press you here on the notion of the individual decision question. How then do we square the circle with respect to making an individual decision and then getting to herd immunity? If a society says, everyone in a society says, yeah, I'm not going to take the vaccine because of an individual decision, but there is also a public health interest, a public health and safety interest. And that can go back to polio. We had to get vaccinated for polio. Yes, that goes back to measles, mumps, and rubella, which we get vaccinated against. As a matter of fact, the data shows that Grenada is one of the most vaccinated countries in the world. That's before COVID-19, of course. So how do you square that circle?
Well, Kalon, it's we have to go back and look at the whole development of vaccines and the process of having a vaccine that was accepted to be used worldwide. For example, polio and those diseases that we all have been vaccinated without much of a resistance. We must accept the fact that the COVID-19 vaccines are relatively new to us, and there is always going to be vaccine hesitancy. There's going to be low uptake initially. With time, and I did emphasize in our first conversation that with time, if we were to focus on the barriers that are preventing individuals from taking the vaccine, then we would see gradual an increase in vaccination uptake. And that is a natural process. Eventually, Kalon, everyone would just accept possibly the COVID-19 vaccine as a routine. But with this novel experience, it is expected that we have that resistance. So I'm not sure why individuals who are responsible for rolling out the vaccination programs are not focusing on removing the barriers that exist, because as long as these barriers exist, as long as individuals would, in their assessment of risk, intake, whether they're misinformed or not. The fact is that based on the information an individual has, they're going to evaluate risk. And if that is misinformation, then their risk is going to be higher than it should be. And there's no way that they would going to accept a vaccine where in their minds the risk is too high for them. And that's what we need to focus on. If we, even if we had a population that is totally acceptable, it has been shown that individuals who are more health conscious would naturally accept the vaccines or any health programs easily. And there's going to be a group of individuals who's going to resist, who's going to take a longer time to buy into the program. And so my disappointment is the fact that we are just focusing on encouraging individuals to take the vaccine, which is good, but it wouldn't work for everyone. It works for some. And so if we want to increase our vaccine coverage, then we have to use more than one strategy, not just asking people to take it because that's the result, but identifying what the barriers are. And if we can do that, and in my observation, just speaking with individuals don't feel safe. They don't think that the vaccine is a safe thing to put in their bodies. And if in my assessment of that, I feel so, then I would not take it. So simply, that's one of the major barriers that exist. And I'm appealing to the authorities to seriously consider that, because we all want this population, we want to control the spread. We want the population to develop a certain levels of immunity over time. So let us look at different strategies that we can employ to get it to that point. Just encouraging by having, media, we have in flyers, on radios, televisions. That's going to catch a percentage of individuals. It would not catch everyone. We need to go further than that. And the science shows that once we're going to come out with something that's new, there are going to be individuals who are going to resist, but eventually they will accept it. So we just need to focus on different strategies to get that done.
Mm-hmm. And let us now look at the what has happened in Grenada last week with respect to involuntary closures of businesses, with respect to what we've witnessed around the Royal Grenada Police Force. The numbers to me are quite worrying when your national security apparatus, your law enforcement apparatus has such huge numbers. I think the positivity rate in the police force per thousand. I think the size of the police force is what, about 1,000 people, I think.
I'm not sure the exact numbers.
Yeah, to me, when I lived in Grenada, it was about 700, 800. But to me, that seems to be very worrying when a critical arm of law enforcement in the state has such high COVID numbers. By implication, that means that people have to be isolated, right? But by implication, it also means that given the way that law enforcement interacts with the population, that the chances of that spread can be significant. So I just want to get a sense from you as to, given the picture, and of course we've seen business closures as well. A lot of businesses are shutting their doors. Yes, please proceed. Just want to get a sense of what you think that looks like.
Yeah, well, it's an experience that I expected. It's our first wave, and we're going to have those reactions. I think again that proper advice on how we deal with it. So, for example, the police force is a high-risk group. They're basically one. They're usually they're centered in central locations. So we have police stations. Then people come into the to make reports, etc. So they're constantly in contact with individuals, even when they're patrolling. They come in contact with individuals regularly, and as a high risk group or cohort, then there should have been an extra focal point on safety measures and adhering to protocols and those things. Having said that, there's no way we can go back to that point, but I think that should be strengthened, and because we cannot afford for the law enforcement to have a large percentage of individuals contracting COVID-19. That's going to affect many different things. So that needs to be strengthened and tightened up a bit so that there is no additional spread among the law enforcement of Grenada. In terms of the response to business places, it's closing down involuntarily to ensure that the spread doesn't continue. We would not want it to continue, but we expect to see additional business places responding like that. It shouldn't be an overreaction, because once we've identified individuals that may have had exposure, or if there was a case present at work or someone visited, then we should have established protocols to follow. For example, if we're going to close for a few days, I know that during that closure, sanitization of the entire building, etc., have been going on to ensure that the virus doesn't survive, and we can reopen after a few days. There may be sort of a shortage of workforce individuals because of that. So there's going to be a slight impact, but I don't think we should overreact, because what we expect, and I did say that, Kellon, we expect September and October to be those 2 months where we're going to see an increase in the number of cases. What we do is going to help control how quickly it spreads, how severe it affects us, the impact it has on our economy, and on individuals, on the healthcare system, our behaviors. But at this point, we cannot stop the spread. We could slow it down, and at the rate at which it happens, we could attempt to reduce the number of individuals who are going to have severe symptoms by increasing vaccinations, etc., and looking at an analysis of the parishes that have been most affected and vaccination levels, to determine how we can prevent what may happen, because a parish like St. Patrick's, where we've had very low rates of COVID-19 cases, they will be more susceptible to future outbreaks. And so a drive to increase vaccination coverage should be now, whereas not waiting until it starts to happen, because the populations within Grenada that are most susceptible would be the one where we would not have had most exposures.
And Brian Grimes is reminding me here, he said, Dr. Bubb, over 40 nurses have tested positive also. It's not just the RGPF. So we're talking about, to me, those are very concerning numbers for frontline workers in general. Your thoughts?
Yes. The nurses have been working very hard. Doctors have been working very hard, and naturally there are going to be exposures. And so if we do not adhere very strictly to the protocols, we're going to have that spread continuing. And that's what I said, it must be strengthened and enforced to the point where there isn't any room for a lapse in adherence to the protocols. We must tighten up those areas, especially the high-risk individuals, because we cannot afford, Kellon, for the healthcare system to have the professionals being quarantined and a large percentage of individuals not being able to produce and come to work. We already do not have the best healthcare system. We already do not have enough healthcare personnel. And if that continues to affect us, then it's going to get even more challenging for us.
And Ottilie Renaud Thomas is making a point here. She said there is clear evidence that businesses were not following protocols. A positive case within the establishment should not cause widespread exposure if protocols are maintained. It's a learning curve, and hopefully they can reopen with higher standards of safety and prevention. Jared?
Yes. And prevention, yes, Kellon. And a lot of the things that we are seeing happening and we are discussing now, Kellon, we spoke about it in the first program I appeared on, where protocol adherence was very important towards curbing the spread of the virus. And I don't believe that we took it seriously enough. We did not look at ways that we could have strengthened it. Individuals who are walking around and continue to walk around without wearing a mask. I still don't believe that the sanitization process and the adherence and the monitoring of protocols within the business places are done properly. Even the records that we are taking, who verifies the names that are placed on the records? Individuals are writing fake names and numbers and
But
addresses.
but and
Um,
I'm glad you're raising that, because I'm gonna also make the point that yes, you said vaccinations are personal choice, but there's also personal responsibility on our parts to ensure. I was just in Grenada recently, and there was a gentleman in my home village of Pomerose who decided he was going to cuss me because I told him to wear his mask inside my uncle's ice cream shop. Right? And the man wanted, like, who are you to tell me to wear my mask,
uh,
right?
I,
So you
I,
also have the question of personal responsibility.
Yeah, I got that. I got that last week from a gentleman. I asked him to wear his mask properly, and he responded to someone who was close by. He said, "Who does he think he is?" So
Right.
I just said, "Man, just wear your mask properly because we have all have a personal responsibility to follow those protocols. To ensure that we have a better grasp on how quickly this spreads within our population. We have not taken this seriously enough. You mentioned in the last program, even the quarantine time of 2 days is not exactly 2 days. And I've actually experienced it with one of my friends who came from New York. I mean, it wasn't an exact 48 hours. And so these are
No, it's
little
not.
lapses we're having because
Yeah.
I did my COVID test on Wednesday. I got the result this morning via email. It says that I'm negative. But what happened between Wednesday and today? It doesn't mean that I'm
Right.
negative today. The COVID test would measure your disease status at that point at which
At
the
that point
sample
in
was
time.
taken.
Precisely.
Right.
Precisely.
So between
Yes.
Wednesday and today, I could have been exposed. So it doesn't give me the right because I received my negative test result today, that I can go jump around in Grenville without a mask, talking, spitting, and not adhering to the protocols. So we need to understand that because there isn't any room for us to let up right now, Keller. There isn't any room. We all must tighten our approach, even adjust the way that we think in terms of this virus. It's part of our lives, and it's going to be part of our lives for a while. And we need to make that adjustment that ensures that we slow down the spread because we cannot get rid of it now. It's going to be here and it's here to stay. And it's going to mutate and we're going to have new variants coming in. But we can adjust our lives permanently to ensure that we deal with this in a way that it doesn't create that impact on us that would cause us to not have a good quality of life.
Let us look at this curve. I have I have the curve. This is from worldmeters.info that feeds information and data that the government of Grenada sends to the World Health Organization, because they have to track the data. And this is really worrying, right? This is an extremely
Almost
steep
vertical,
curve,
right?
right? It's a steep curve. It's like one of those rockets that go to space, right? So we were at zero, 14th of July. And of course, we also have to bear in mind that a lot of these infections were imported infections as well. So those numbers were imported numbers that were captured at the borders through testing.
Yes.
August 15th, August 19th. So I think maybe around like maybe the 15th of August or thereabouts, then the numbers really started to
It's
get
starting to,
out of
yeah.
hand. It's a start. So getting on the other end of that curve, because that's where we need to go, right? We need to get on the other end of that curve so that the curve looks more like what we were seeing in July.
Yes.
How do we get there? How do we get there? And that also has to do with, yes, personal responsibility. But what does public health have to do at this point in Grenada to ensure that we can get to the other side of that curve? And let me stick a pin. I want to play a video for you that a viewer sent in for us, and I want you to comment on that as well.
Testing at 1, 10 just going up at 1, eh? Watch this. Watch a super spreader even. This is it. This is the government of Grenada for you. It's hot. I'm sweating. But if you plan to come to Spiceland for testing, I would advise that you don't, because they only testing people with symptoms or if you're in close contact. After they don't tell everybody to come out here, sun hot, 1:30, they're just setting up. We're still in the sun. Don't waste your time. Ollie, what?
Okay, that was from yesterday. That was at a mass testing slash vaccination site in the south of the island. And I believe that the government would be mounting these caravans across the country. Well intentioned. I don't think anyone is questioning the intention of the move, but logistically, as someone in public health, what does that look like to you?
It doesn't reflect good because it tells me that there wasn't that level of planning and execution that is expected, especially in the midst of a pandemic, and more specifically an outbreak in Grenada. If we're going to roll out mass testing sites like that, we must have protocols and we must have strategies put in place to monitor and to ensure that individuals adhere to the protocols. So we shouldn't just announce there's going to be a mass testing site without further guidance in terms of expected behaviors and restrictions and responsibilities of individuals. So it's like saying we're going to have a health fair, we are just asking individuals to come to the health fair without even looking at the conditions under which we are testing them, whether or not they're ideal, so the test would perform in the conditions that they were made for. So these are things that we all must think about. And I'm again appealing to the authorities to not just get carried away with reacting to what is happening, but let our reaction be one that is guided by the practice that is expected, that would ensure that the highest possible standards are adhered to. This would in one way or the other help to establish the fact that we really know what we are doing and not just reacting to a situation, but in the reaction that we are, because there must be a response. Public health must respond, and that's part of the response. But our response must be guided by set protocols and strategies, even during this time where we have an infectious disease that is easily transmissible from one person to the other, to a susceptible individual. So, Kellon, I'm saying, yes, it's something that we must do, but the planning and execution needs to be improved and strengthened. And the messages that we send out, because when we send out a message to the population indicating that it's going to be a testing site, we must have additional information with that. We must not just say that we have that. So we must ensure that we continue to sound over and over. And in addition, have individuals there who are going to assist with ensuring individuals or patrons adhere to the protocols, the social distancing, wearing a mask properly, etc., etc.
And let's get to some other comments here. Howard O'Neill Bain is saying, it's sad the way some people respond to being asked to do the right thing. Jennifer Gibbs is asking me, Kellen, do you think if you had a mask to offer the individual, would he have accepted it? Except the individual had a mask. The individual had a mask.
Kellon, I just want to add something here.
Yes, please.
Yes, please. Also, we need to accept the fact that the PCR test is not 100% sensitive. Clinically, it has been proven to have a sensitivity of between 66 to 80%. So based on the, many things affect test and testing conditions, the time, how long we keep the samples before actually running it. So those things, we can get false negative results. We can, if the swab is not done properly so that enough of the virus is transmitted to the swab and so that we can test. When we do the swab, or there isn't a high enough viral load, so the person just got infected, I can have a negative test and still be infected. So 1 in 3 persons, clinically it has been proven, we may miss that is infected. So we shouldn't think that it's 100% sensitivity, and sensitivity here speaks to the accuracy in identifying positive individuals, right? So if I have 100 individuals, if 100 individuals has been infected with COVID-19 and I run a test on them and we are able to identify 90 of them correctly, then the sensitivity is 90%. So the positive accuracy of the test is called sensitivity. The PCR tests are not 100% accurate. we would miss individuals. So there are going to be some slipping through the crack. That is why adhering to the protocols becomes so important, because we're going to miss people, and so in missing people, individuals can, become think that a test result is 100% accurate, and so not adhere to the behaviors that we expect them.
And you can be lured into a false sense of security as well, right? That,
Yes, yes, that's
I
what
don't
we're
have
talking
COVID.
about.
I don't have COVID. I'll go around the country and not wear my mask. You can't tell me
Exactly,
anything. The state
exactly,
says I'm negative.
exactly.
So, right. Yeah. Dane Andrews is asking, can SGU be used as a sample size in a situation where, if constricted to the limitations of the facilities, if an outbreak were to occur, what steps, protocols, and protective procedures would fall into effect? And would the results of such a sample size / study be able to be used as a solution to the ongoing situation nationwide? That question went over my head.
Well,
But yeah.
well, as the data from SG obviously would be must be submitted to the Ministry of Health,
Mhm.
because the Ministry of Health is the overriding body, and WHO overrides all the countries. So data from COVID-19 results must be submitted to the overriding or managing body of each country, because it's a reportable disease. It's a notifiable disease. We have to notify authorities. So whether or not studies could be done, the St. George's University cohort or sample is a unique sample.
Mhm.
Well, if we conduct studies from that sample of individuals, whether or not we could apply to the population may be questionable, because we expect individuals who are in these environments may be more health conscious, um, and so may seek attention earlier, etc. And those things, those variables do exist. But yes, that's a good suggestion. But that would be up to the Ministry of Health, because they are the overriding body, the managing body of all the statistics. All tests that are done and the numbers must be reported to the Ministry of Health.
Lorna Charles asking, is the epidemiology model used in Grenada specific to our societal structure?
Well, we can apply the epidemiological model to any society. In terms of understanding of the disease, I mentioned that the epidemiological triad that we referred to. We always look at the host, the agent, and the environment. At different points, we attempt to intervene so that the disease is not spread. So we may look at the environment and see how the environment contributes to the spread. We look at the host. So, for example, humans. How do we contribute to the spread? And develop protocols, develop behavior restrictions, policies, etc., to prevent the spread from one person to the other. We may also look at immunization, in this case, vaccination. How do we expose individuals to a mild form of the pathogen so that they develop an immune response when they do get exposed to the actual pathogen? In this case, we are not developing full immunity, but we are having a response that doesn't allow us to have extreme conditions as someone who was not vaccinated. So the model, an epi model, can be used in any society. What we have to be concerned about is the barriers that exist within our context, because our population would have different barriers to a population in Europe or a population in the US. And so we need to, and that's why I'm emphasizing, if we do not identify what barriers exist, what are the behaviors, what are our mindset, how do we feel about COVID as a Grenadian, our response to it, our thinking, our knowledge, etc. If we do not gather that information, we would not be able to apply effectively an epidemiological model that will help solve the problem.
And that is why research is so important. Research is critical. You have to, and the ministry must be complemented, although I think they did it late, honestly, having a public fora with the community. That should have been done since last year. We shouldn't have to wait until we are now in the middle of a disaster, an epidemiological disaster, to then decide that we're going to have a caravan that goes out to get people's opinions on these matters, because
You know,
these opinions qualitative as they may be, is extremely important for then determining how you would craft your messaging around this issue.
You see, Kelon, one of the weaknesses that we have, and I would agree with you. I would say that the Ministry of Health has did a good job. They tried their best, considering the limitations of resources and personnel. But I am aware of a weakness within that whole approach, because when you look at the individuals who are leading the drive on this, Kelon, all these individuals have been trained first as doctors, then as public health professionals. So there's a thinking. The approach largely initially has been more so of approach from a medical clinical perspective, and there wasn't a balance from the public health perspective. So if we had a team that was able to create a better balance with public health and medical strategies, we would have seen some of the things that I'm speaking about coming through in a stronger way. And that inherently lies where the problem is. If you're trained as a medical doctor, you think as a medical doctor. When you're trained as a public health epidemiologist and professional, you think a little bit differently. And so working together would have created a better, a more holistic approach in how we responded to the messages that we sent out to the population, etc.
And we have another comment here, Maria San Bernard. I'm going to put it up again. I applaud Mr. Sincere for his clarity and knowledge of the science. Dr. Bubb, please continue to invite him to the program to enlighten those of us who continue to seek responsible information. Well, he's a past student of PBC. I was not going to bring that up, but
There you
he
go
is.
again.
He has an obligation. He has an obligation to appear on the report. But Marie, absolutely, I think Maria, I think the public really appreciate the input that he is bringing to the program. Martin Felix is saying the PCR tests is regarded by the WHO and other international institutions as a gold standard, but there is always the caution that it is not 100% accurate. Ricardo
Exactly what I was
Quinzanos is
saying.
asking another question. Yes, he's saying, what about the buses? How do we solve that? It's very hard to social distance on our buses, but transport is a necessity to the nation.
Yes, Kelowna, this has been some of the criticisms that the Prime Minister received when he sort of released, rolled out the restrictions that were added. And there is a thin line, and I believe, yes, individuals felt that there could be some restriction on the buses because they tend to be crowded. I'm not sure why that was missed or the reasoning behind it, but I would say, yes, it is a potential environment where it can be spread. But I'm saying again, if everyone is wearing their mask properly and the windows are open so it's not closed, and there's a constant flow of fresh air, etc., and you're wearing your mask, then it becomes very almost impossible to contract it for a journey from Grenville to St. George's. Wearing your mask properly prevents you, if you're infectious, from infecting someone who's susceptible. It also prevents you from getting contaminated or ingesting contaminated droplets. So yes, I do agree, and I've spoken to a number of individuals who mentioned their concern about that, and I just would think that there may be in the future, if it continues to rise. But I say again, it's a response. The individuals on the bus, the bus drivers, the conductors, need to ensure that someone who is entering the bus is wearing their mask properly, and even during the journey, each individual wears their mask properly during the journey.
And we have some, and we're coming to a close shortly. We're getting to the end of the program. But Marisha is saying, very good point, Gerard. I'm still waiting to see more data on the infection in Grenada. Arthur Lee comes back and says, by adhering to the protocols that can be maintained while in transit, mask wearing, sanitizing,
Precisely.
not talking, etc. But Mr. Sensei, you also have to socially distance. You can't socially distance on a bus. So
Exactly.
but you get what I'm saying. I mean, I don't want to sound crazy here, but that is an expectation. You have to maintain social distancing unless the buses make a decision to have less passengers, right?
Yeah, you see, and you see,
Which is a
Kalan,
very difficult
what we're
thing.
saying. Yeah, it's a very tricky one. It's a thin line, right? So we did not receive any additional restrictions for travel on buses, right? So now individuals have to operate within that to ensure that they do not expose themselves to 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 an infectious person or infectious material. And so this is what I'm saying. Whilst the journey, from any point, from point A to point B, anywhere in Grenada, we do not travel for more than an hour. So it's like 45 minutes to an hour. Most trips are, and much time is a lot less than that. So I'm saying for that half an hour, that 45 minutes, that 1 hour drive, let's adhere strictly to the protocol. Whilst you're on the bus, because in this instance, the social distances cannot be realized because of the nature of our buses. And there was no additional restrictions on number of passengers. So if you are to travel on a bus, then ensure that you are wearing your mask properly. Ensure that you have your personal hand sanitizer that you're going to use when you get into the bus. After you leave the bus, you use it again. Refrain from touching your faces, your eyes, etc., while you're on the bus. And those things would help reduce the chances or your risk of getting infected.
Mm-hmm. We are about to close here, but I would reinforce an earlier question that I posed, which I don't think you got an opportunity to answer. Getting on the other side of that steep curve,
Yeah.
how do we get, given our own unique local conditions, how do we get on the other side of that curve? Another thing that's worrying to me has to do with the rate of hospitalization, but not only the rate of hospitalization, the rate of recovery of patients who are currently warded at the hospital. That to me is extremely worrying given the fact that we do not have a lot of ICU beds.
Yes. And Kellan, so let me respond to that. I think I missed it. You did ask, and my apologies for that. I did miss
Yeah, no, that's okay.
responding.
Yeah.
I would say, one, first of all, we as individuals need to look at ways that we can boost our immune response, boost our immune system, even before we may potentially get infected, because that largely has to would depend on how your body responds, etc. So things like ensuring that you adhere to a healthier diet, some more exercise, vitamin C and zinc. Fruits and vegetables help to, cherries, etc., help to boost your immune system. I'm not a nutritionist, but I know we can do some simple things. We can use some simple things to help boost our immune system. How do we get to the other side, Kellan? A lot of the times we get to the other side with time. And so with time, we're going to start, because the natural progression is that the disease or the pathogen is going to continue to spread from an infectious person to a susceptible person. That's how it survives. Now, if an infectious person or all infectious person do not come in contact with a susceptible person where we have effective transmission. So if that doesn't happen, so if all the infectious individuals or all individuals who will become infectious do not come in contact with a susceptible person so that effective transmission occurs, the virus dies within our population. But that wouldn't happen. So what we would have to do is try to reduce the number of contacts that infectious individuals have with susceptible individuals in an environment where successful transmission can occur. So if I'm infectious and I'm wearing a mask, there is no way I can infect a susceptible individual. If I'm infectious and I'm not wearing a mask and I sneeze or cough and I didn't follow protocols to prevent the droplets from spreading, and there are susceptible individuals in my immediate environment, but they're all wearing their mask, they cannot be infected. So it largely depends on our behaviors, because as long as the virus continues to find susceptible individuals, it's going to continue to spread. and the curve is going to continue to rise. Now, the rate at which it rises is going to decrease with time because immunity levels, the number of susceptible individuals and successful contacts is going to reduce with time. And so largely on time and how we control the spread. So the successful contacts between a infectious person and a susceptible individual that are not following the protocol on either or, then we would have continued spread and the curve is going to continue to rise and eventually is going to taper off because the virus is going to find less and less susceptible individuals as we continue to strengthen our adherence, increase our adherence to the protocols. Wearing a mask and hand sanitization is going to find less and less susceptible individuals, and eventually the curve is going to taper off and reduce to some endemic levels within our population.
And that would hopefully be the end of the first wave. Hopefully we wouldn't have a second wave.
That would hopefully be the end of the first wave. Any second wave would be, one, if it's the same variant, wouldn't be as rampant as this one. But if it's a different variant where we do not have immunity levels against, it's going to be similar to this one. That's the scary part of it.
Yes.
So
yes.
Adhering to protocols like wearing a mask and sanitizing your hands is going to be part of our lives for a long, long time.
And,
until we find a vaccine that may be able to provide total immunity.
All right, Gerard, thank you so much again for availing yourself of time to really have a conversation with the Grenadian population. Please, those of you in the Grenadian expatriate community in North America, and those of you in Grenada, please share this program so that we can continue the drive of educating and informing our populace about really a very difficult and an uncertain period for a lot of people. So again, Gerard, thank you again for appearing on the report.
Yeah. Kellon, thank you very much for having me, and to all the viewers who would continue to look at Kellon's program, the Bubb Report. It's a very interesting and educating, informing program. Before I leave, I would want to encourage all individuals, whether you're in Grenada or the diaspora, to be safe, continue to be safe, and be an agent of safety during this time. Thank you very much.
All right. That was Mr. Gerard St, a resident epidemiologist with the Bubb Report, but also an epidemiologist who works at the St. George's University. He, of course, is appearing here in his personal capacity. As a reminder, for those of you who are in the Washington, D.C. area where I currently reside, I will be mounting a campaign, a mask donation campaign, especially if you can get surgical masks. To me, I would ensure that those masks make their way to Grenada. But if you have no way of getting to me in Washington, D.C., you can certainly contact the Grenada Embassy, which is located in D.C. as well, and you can drop those masks off there. Let us do what we can to support our Grenadian citizens at this very difficult and challenging time. On behalf of the producers of the Bubb Report, I want to thank you again for participating, viewers and listeners. Thank you for your excellent questions and comments today. And we will see you next week again for another installment of the program. Have a great Labor Day weekend for those of you in North America, and have a great and safe week ahead. Bye-bye.